Hello,
Hello.
my name is Natasha Uilkie. I'm the nurse practitioner student here, and today I just wanted to do a assessment and chest and lung exam. Can you please give me your full name and date of birth?
Robert Scott Szymanski, August 9th, 1986.
Very good. Thank you. I'm going to perform some hand hygiene. All right, excellent. So first I'm going to be doing a visual exam of the skin for any primary or secondary lesions, including macules, papules, vesicles, bullae, or patches. I notice that there is some slightly scattered macules. None are raised, and there's no presence of any papules on the forehead. Good. I'm going to check the posterior side. I do see a couple macules, nothing raised, no tenderness. Have you noticed any spots that have bled recently or raised or are tender or increasing in size?
No.
Okay, great. Back. Next, I'm going to be testing the musculoskeletal range of motion, specifically in cranial nerve 11, the spinal accessory muscle. So Scott, go ahead and shrug your shoulders upwards. Good, as high as you can. Shrug, shrug, shrug. Okay, and don't let me press down. Very good. Okay, go ahead and turn your head to each side. Good. Good range of motion. Next, I'm going to be performing the Sperling test, which checks for cervical radiculopathy. So Scott, I'm going to have you tilt your head to the side. I'm going to apply light pressure. Okay. Any pain on this side?
No.
Any pain that radiated down to your arm?
No.
All right, great. We're going to do the other side. Light pressure. Any pain?
No.
Okay. So this lateral flexion will also check the range of motion in the sternocleidomastoid. All right, I'm going to turn you to the posterior side. And I'm going to just do some palpation, check for any lumps, bumps that seem abnormal, and comparing the sides bilaterally. Great. No, none found. I'm going to perform tactile phragmitis, which is basically just the vibration of the voice heard manually. So I'm going to use the ulnar surfaces and start up in the fields where I would normally assess with auscultation. So Scott, if I can just have you kind of give yourself a hug so I can get the scapulas out of the way. When you feel my hands on your back, please say the word 99.
99. 99. 99. 99. 99. 99.
Good, thank you.
Mm-hmm.
So I'm aware of the intercostal spaces and avoiding the ribs because I will find dullness in those areas. Next, I'm going to perform percussion. So I'm going to use my non-dominant hand, finding the intercostal spaces, and I'm going to tap my middle digit with my other hand right on the IP joint. So you find a good sill, get in that intercostal space, being aware of avoiding the scapulas. We do 2 taps. Good. This is being aware of the lobes of the lungs where I find hyperresonance and dullness. I should hear a really nice resonating sound, and being really aware of my landmarks, the apices, intrascapular, and the medial lobes of the lungs. So I'm going to match on the other side, finding the intercostal space. So here is the scapula. Okay. Next, I'm going to be testing for the diaphragmatic excursion, which is basically the area in where the diaphragm moves upon inhalation and exhalation. I'm going to be using percussion and also going to be marking the skin. For most people, the diaphragm starts at the 8th or 10th intercostal space, so I'll go ahead and start there. So Scott, what I need from you is to take a nice deep breath in, and you're at the top. Hold, please. So going to find the 8th intercostal space here. 1, 6, 7, 8. So deep breath in, please. Okay, go ahead and exhale first. Not yet. So exhale, please. Inhale and hold. Okay, exhale. So I'm finding the place where I find dullness. I'm going to mark with my pen here, that area. And this is actually the inferior border, so from here I'm going to percuss upward. So deep breath in, please. Hold at the top. Good, and let go. So this is the area of diaphragmatic excursion. I'm going to mark the top here. And I'm going to perform the same on the other side. My hope is that they're matching bilaterally. So, nice. Over here. So 8th intercostal space, I have 5, 6, 7, and 8. Okay. Deep breath in. Hold. Okay. Exhale. All right. They seem to be equal bilaterally. My next exam is going to be auscultation. This will be my best way of finding out if there is any lung consolidation in the tissue, which could be found in pneumonia. First, I'm going to be testing for bronchophony, which is just the sound over the lung fields. So Scott, when you feel my stethoscope on your back, please say 99, starting in the apices and being aware of the scapula.
99, 99, 99, 99, 99, 99, 99, 99.
Good. Next, I'm going to be testing for egophony, which is a very high-pitched nasally sound, which will make an E kind of sound like an A. So Scott, same thing when you feel my stethoscope touch your back, please say E.
E, 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 E,
And the medial sides.
E, E.
Very good. Last but not least, I'm going to be testing for whispered picturoliloquy, which is essentially an exaggerated form of bronchophony. This tests for consolidation in the lung tissue as seen in pneumonia or COPD exacerbation, pleural effusions. Essentially, a whispered sound is going to be hyperresonant or a lot louder upon auscultation. Scott, when you feel my stethoscope, please say 1, 2, 3 in a whisper.